Hi, my name is Dr. Polley. I'm a craniofacial surgeon and the inventor of SaniiSwab. I've been in practice for 34 years. First 25 years of my practice was in Chicago. I spent 10 years running the Craniofacial Center at the University of Illinois in Chicago, and then spent 15 years as the chairman of plastic surgery at Rush University in Chicago. Simultaneously during that time, I spent 15 years at Cook County Hospital doing all the major maxillofacial trauma. I do a lot of facial surgery, I do a lot of nasal surgery, and a lot of rhinoplasties. And in 34 years, I've never had a surgical infection. The reason for my success, I believe, is twofold. Number one, I always prep and drape the patient myself. And number two, I always follow what we call a two-step dual prep technique. So what is a two-step dual prep technique? Well, it's the most efficient way that we prep and clean a patient in preparation for their surgery. Two steps means two separate cleaning techniques, utilizing two separate cleaning utensils. Dual prep means we use two separate sanitizing or cleaning agents in each of the separate steps. So step one we call the cleaning step. We clean the surface of the skin with a sanitizing agent as well. Now we have a clean skin surface. Now we come back to the same area in step two and clean it again with a different sanitizing agent. So we've done two steps, dual prep. You can think of it as washing your car. You don't go out to your car and just start putting wax on your car. You wash your car first, clean the debris, then apply the wax. The same thing here, two-step dual prep. First step is cleaning, second step, sanitizing. Both steps with a sanitizing agent. So how does SaniiSwab get started? I was working in southern Michigan and there was a lot of COVID. I was seeing COVID patients in the clinic, I was seeing COVID patients in the emergency room, and I was operating on COVID patients. And I thought to myself, this is not good, I'm going to end up with COVID. But then I said, hey, wait a minute. I know how respiratory infections start. We first breathe them in, they get trapped most of the time in the anterior portion of our nose. They then go through what we call an incubation period, where for several days they sit there until they become infectious. So I said, I'm going to use my same two-step dual prep nasal cleaning technique that I've used on my patients for over 3 decades on myself to prevent myself from getting sick. And that's exactly what I did. I cleaned my nose over twice a day with the two-step dual prep technique, just as we use with SaniiSwab, and I never got sick. Then I thought, you know, I've been doing this for a long time. It's helped me personally. This technique has helped my patients. This is a great thing, not just for my patients, but for all patients in the hospital, and really for everybody to use as a nasal sanitation technique. So how did I come up with the SaniiSwab design? Most importantly, I wanted to follow the important two-step dual prep technique that we utilize in surgery and that I've used personally and for my patients. I also wanted a design that would not allow us to go too far up into the nose and violate the nasal mucosa, that would stay just on the skin of the nose of the nasal vestibule. I also wanted a product that would be very easy to use, that would be over the counter, that wouldn't require droppers and bottles or running water, and that could be taken with you on the fly and used really anytime, anywhere. So that's when I came up with the design of the SaniiSwab. I designed the dual swab technique, and this has several functions. Number one, it allows us to clean the nasal vestibules, to clean our nostrils simultaneously at the same time. Also, and very importantly, it has what we call a nasal guard or nasal columella. That top portion connecting the two swabs will not allow you to put this too far into your nose, so you're not going to go up past the nasal vestibular skin into the nasal mucosa. It keeps the swabs exactly where we want them to perform the cleaning function exactly where we want it. So when we think about human hygiene and keeping ourselves clean, we all know how to wash our hands. We've been taught many times how to wash our hands, how frequently we should be washing our hands. But how and how frequently have you been taught to wash your nose? Did your mother teach you how to clean your nose? Your grandmother? How about your third grade teacher? Was there a course on cleaning your nose in nursing school? Was there a course on cleaning your nose in medical school? No. We're never really taught the proper way to clean your nose. And if there's one thing I know how to do after 34 years of nasal surgery is I know how to clean the nose. And the way to clean it is with SaniiSwab, utilizing the two-step dual prep technique. Cleaning our nose is as important as cleaning our hands on a daily basis. If someone said you can only wash your hands or you can only wash your nose, I would choose washing my nose. How to use SaniiSwab. SaniiSwab comes 2 steps, dual prep. 2 packs are connected together. Step 1, you simply tear open the step 1 packet. You pull out the SaniiSwab. This is the columellar guard. It can't go too far in my nose. You got to place this in your nose and you got to rotate it around. The instructions say 7 times, but you want to do it for about 30 seconds at a time. In your nose, can't go too far, rotating. And it's important. This has a sanitizing agent on it. But it's not just the agent that works. It's the actual mechanical cleaning, the mechanical brushing against the sidewall of your nose that's important as well. So you work back and forth, get the front part of your nose. And again, I can't go too far into my nose because of the columellar guard or the innate guard on the swab. After 30 seconds, take that out. Wow, that feels good. That's step 1. That's the cleaning step. Now I've cleaned away what we call the nasal carriage. You can call them nasal boogies, all the debris in our nose. Now I have a clean surface that's also been sanitized. Now remember, 2-step dual prep. I open step 2. Same thing. Now I have a clean surface. I'm not wasting my sanitizing agents on being absorbed by crust and debris. I have a clean surface, and now again, mechanically cleaning again and really sanitizing the inside of your nose. Just like we do at the time of surgery. 2-step, dual prep. And I do this for about 30 seconds again. The instructions say rotate 7 times. That's great. But I go back and forth, and I'm really feeling the sidewalls of my nose. So remember, it's not just the sanitizing agent that's important in the SaniiSwab, but it's the mechanical action of actually cleaning as well. Think about cleaning your hands. You don't just put soap on your hands and walk away. You wash your hands. There's a mechanical cleaning to it. We're doing the same thing to our nose with SaniiSwab. So SaniiSwab, step 1, we take the double prong out. Again, columellar guard, can't go too far into your nose. Place it in. And it's important when we clean with SaniiSwab that it's not just the sanitizing agent that's doing the work, but it's also the mechanical cleaning. I'm physically cleaning the sidewalls of my nasal vestibule, the sidewalls of the nose. The instructions say 7 times in a circle, which is good, but you should clean for at least 30 seconds per SaniiSwab and really go around, feel the edges of your nose, clean, 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 just like you're scrubbing your hands. Wow, that feels really good. Step 2, same procedure. We're going to scrub for 30 seconds. Columellar guard, can't go too far in. Scrubbing the sidewalls, round and round. I can feel the swabs in my nose. It feels good. I can feel them actually mechanically cleaning at the same time utilizing the sanitizing agent. It's the mechanical cleaning plus the sanitizing agent, 2-step dual prep. Wow, my nose feels really good right now. That's SaniiSwab.